Welcome to your weekly wellness dose, The Wellness Factor. I'm your host, Dr. Noelle, and today we are discussing menopause, the change we all eventually experience as women and yet still seem to be mystified by. But let's demystify menopause today. Welcome to Menopause One-on-One. So perhaps we could first define what menopause is. Menopause is defined as a cessation or stop of menses, your period, for 12 months consecutively. Now, that's just the tip of the iceberg, as there are many changes hormonally, physiologically, and psychologically during this transition period. And the period of transition is what we call perimenopause, the time period prior to menopause where hormonal shifts occur and symptoms can start to arise, which we'll get into in a bit more later. But this transition could look very different from one woman to the next. And on average, this transition period can occur over 4 to 10 years prior to full transition into menopause. For some women, may start as early as mid to late 30s, but the average start for perimenopause is about 45, or average age for full transition into menopause about 51 years of age. The postmenopausal period is essentially for the rest of our life after menopause. And yes, ladies, menopausal symptoms can linger for years, if not decades, after we have transitioned. So now let's remember, menopause is not a disease. It is a natural transition of life. So it's not to be looked upon as something we must treat or medicate. However, we also don't need to suffer. And there are things we can do both behaviorally and through hormone supplementation to make this transition easier. So let's get into some of the signs and symptoms of menopause and perimenopause, which we typically see with changes in menstrual cycle first, where again, this can vary. The period may occur less frequently, skipping months, or the bleeding pattern is more erratic, where there's bleeding in between periods. Maybe bleeding becomes lighter, shorter periods of time, or perhaps heavier bleeding can occur when the period does arise. Now, I kind of like to break down the signs and symptoms with what hormonal changes are occurring, and that being a drop in estrogen, progesterone, and testosterone. So symptoms due to estrogen deficiency or a drop in estrogen typically would be hot flashes, the most common symptom, affecting about 80% of women experiencing menopause and can linger for some women decades after menopause, so in the postmenopausal period. Vaginal dryness, vaginal atrophy, which can lead to discomfort during sex, frequent urinary tract infections due to thinner vaginal tissue, less lubrication, cognitive changes, brain fog, forgetfulness, decreased concentration or memory due to drops in estrogen. Bone loss, decrease in bone mineral density can occur during the menopausal period. Onset of cardiovascular disease. So with the decrease in estrogen, there is an increase in risk of cardiovascular disease, which may be mediated by changes in the lipid profile during perimenopause. And so because of this, it is best to do a more thorough cholesterol panel for women during this time of life. So in addition to checking the cholesterol panel, also have your doctor check apolipoprotein B and high sensitivity C-reactive protein, which are inflammatory markers as a means to assess your risk for heart disease and stroke. Now, something else that I've noticed with my menopausal patients, less frequently but evident, is the onset of palpitations. So during the menopausal period, and it is known that falling estrogen levels can trigger heart palpitations or abnormal heart rhythm. Of course, other things should be ruled out, such as thyroid disease and intrinsic heart issue, but estrogen deficiency may be the cause and hence perhaps warrant hormone replacement as an aid. Weight gain. Yes, that can also happen, ladies. I'm sure many of us have experienced this. There are some metabolic changes that occur, and we tend to see changes in fat distribution as well, with more central obesity or fat deposit in the belly, exactly where we don't want it. So here again is where behavior modifications and perhaps hormone replacement may be helpful in minimizing central fat distribution and increase lean muscle mass. So we talked about estrogen deficiency. What about the signs of drops in progesterone? And that could include mood changes, so shifts in mood, irritability, worsening of previous depression prior to menopause, or relapse of a mood disorder previously diagnosed prior to menopause, increase in anxiety, may also occur due to drops in progesterone, sleep disturbances, insomnia, which can be affected by the presence of hot flashes or night sweats due to estrogen loss, but progesterone shifts may also be playing a role. Menstrual irregularity may also occur with changes in progesterone, which we tend to see heavier bleeding with drops in progesterone. Now, androgens, male-type sex hormones, also play a role, and a decrease in testosterone can present with many different things. So that could include decreased libido or sex drive, sexual desire or ability to reach orgasm, decrease in mood, increase in anxiety, perhaps low energy, brain fog, decreased memory and concentration, or perhaps even a decrease in lean muscle mass, thus lowering metabolic rate and potentially causing weight gain. And so as you can see, there are many changes that can be happening physically and emotionally, but there are things we can do both behaviorally and medically if need be to address these changes and make our transition a smoother one. Now, in terms of behavior modifications, here is my prescription. Number one, exercise. Shocker, right? Probably knew I was going to say that. I know I preach exercise often, but it is one of the pillars of our health and longevity, and certainly helpful as we transition through menopause. And why? Exercise helps us to maintain lean muscle mass, which in turn supports our baseline metabolism, hence burning more energy throughout the day and helping to maintain our weight and minimizing weight gain. Also aids in supporting bone health, decreasing risk for osteopenia, osteoporosis, naturally increases testosterone, hence aiding with libido and mood, works as a natural antidepressant. So yes, regular consistent exercise increases the happy chemicals in the brain, such as dopamine and serotonin, which helps to function as a mood and sleep aid. Now, what type of exercise, you may ask? Don't complicate things. Do what you can. Okay, so the goal would be a minimum of 3 hours a week of cardiovascular activity, whether that be walking, dancing, doing some yoga, in addition to 2 to 3 times a week of weight and resistance training in order to maintain lean muscle mass. Now, high protein diets are also helpful, which means you're consuming about 0.7 to 1 gram of protein per pound of ideal body weight. For example, if your ideal body weight is 135 pounds, you want to be consuming about 90 to 135 grams of protein per day. Now, that means that you're consuming perhaps about 30 to 40 grams of protein per meal per day. And why? Well, this aids to increase testosterone levels as well as aid in maintaining lean muscle mass in order to maintain proper resting metabolic rate. High protein diets also aids in supporting bone health, may also aid in lowering blood pressure and prevent onset of cardiovascular disease. Now, this is something you should certainly discuss with your physician, as this may not be safe for everyone, particularly if you have chronic kidney disease. So have that discussion before adopting. Number 3 for my prescription: meditation, breathing exercises. Consider adopting a meditation and breathwork practice. I would say at any stage of life, as it aids the way we handle stress, but certainly during perimenopause and menopause, this can be a helpful tool. And there are specific breathing exercises that can be done to aid with menopausal symptoms, particularly in addressing hot flashes, the most common symptom. So let's try one of the breathing techniques together: Shitali Pranayama, or straw breath. So if you can, smile, clench your teeth so that your upper palate and lower palate are touching. Breathe through the mouth. Close the mouth. Then exhale through the nose. Let's try that again. Using your diaphragm, the belly is soft. Breathe in through the mouth. Close the mouth. Exhale through the nose. One more time. Smile, clench teeth. Breathe in through the mouth. Close the mouth. Exhale through the nose. Now you can do that for 3 cycles or more if you're comfortable. And this should give you an immediate cooling effect. So how do you feel? I hope you feel more relaxed, maybe a little bit cooler if you're having a flash. This breathing technique also aids with migraines and anxiety. So something you can always come back to if you just need to chill out, relax, release a little bit of tension, and maybe minimize a hot flash. So what about supplements for menopause? And here are my top 3. Number 1, magnesium glycinate. Magnesium can help in a number of ways during menopause. It aids with mood and decreases anxiety. It may aid with sleep disturbances and improve sleep quality. It helps to support bone health along with calcium and vitamin D, and magnesium glycinate preferably, as it usually is better absorbed and gentler on the stomach versus other forms of magnesium, and I recommend 200 to 400 milligrams a day. Number 2, B complex. So B vitamins are also helpful with aiding with symptoms and conditions due to menopause, aiding perhaps with boosting mood and easing anxiety. perhaps reduce fatigue, weakness, improve cognitive function, minimizing brain fog, improving concentration and memory, can help to reduce the risk of osteoporosis, and B9 or folate in particular may decrease the frequency and severity of hot flashes. Now, number 3, you may not have heard of this before, but it's an herb, chasteberry. This is an herb usually consumed as a tincture placed on the tongue, which helps to balance hormones in women and can have a multitude of benefits during the perimenopause, menopause period. Chasteberry may aid in minimizing mood swings and anxiety or perhaps depression during perimenopause. Menopause may also help with PMS, so for those who are premenopausal. Could also help to decrease bloating and fatigue and hot flashes during menopause, may also decrease appetite or curb cravings, and maybe increase libido. So I usually source my chasteberry from Kauai Pharmacy, which is based on the island of Kauai, but certainly something to consider as a natural aid for menopausal symptoms. So we've covered behavior modifications and natural methods for addressing menopause, but what about hormone replacement? Because for many, this may be a necessary option for relief. Again, every woman's journey is different, so it's imperative that you have an in-depth conversation with your clinician to determine the best route to take and weigh the risk versus benefits of starting hormone therapy. I personally prefer bioidentical or biomimetic hormones as they tend to be perhaps a safer approach and more tolerable for patients. So you may ask, what are bioidentical hormones? Essentially, these are hormones that are closest in structure to the hormones we produce naturally, usually given in a topical form and perhaps plant-based and perhaps from a compounding pharmacy. So when supplementing, we want to consider what symptoms are present. Generally speaking, estrogen supplementation is helpful for the following: hot flashes, vaginal dryness, prevention of osteoporosis, osteopenia, so loss of bone mineral density, prevention of cardiovascular disease, perhaps to aid with minimizing weight gain and unwanted fat distribution. Progesterone is typically necessary to have on board as well, especially if you have an intact uterus. So uterus is still in place. You want to have that on board to protect as well. It may aid with mood swings, irritability, sleep disturbances and insomnia, perhaps anxiety, menstrual irregularities, particularly heavy vaginal bleeding. You may also want to consider starting DHEA, which is a testosterone precursor, prior to testosterone supplementation, as it too can be helpful for improving low libido, boosting testosterone levels, as well as aiding with mood. This can be given orally, topically, or vaginally. And actually, vaginal DHEA may also aid with sexual desire, arousal, and orgasm. Generally speaking, I prefer to provide hormone replacement therapy topically via a cream or a patch, as it usually is more tolerable and easier to adjust dose or start and stop treatment. So we've talked about a lot for today, and I'm going to leave it here for now, but I hope this gives you some clarity and perhaps demystifies the transition that we all as women will eventually go through if we are blessed enough to get there. And with that said, it is now time for our mantra for the day. So perhaps close your eyes. Allow your belly to be soft. As you inhale, the belly rises. As you exhale, the belly falls. I am open to new beginnings. Possibilities seen and unseen. Open to the grace of my Creator. Open to the transitions that are required. I am ready. Ready to step into my power. I am open to new beginnings. Now you can continue with that breath, with that thought, or perhaps you've had enough for today. I hope your day is blessed and protected. Thanks for listening. Namaste.